Hi, Latrina Kimball. If I'm right with your name, Latrina Kimball says hi. Hi, Latrina. Please, I hope you are fine. Please double tap on the screen to like this video. So I'm going to be starting right now since people have joined. My name is Coley underscore 205. Hi, please double tap on this video to like this video, and please don't forget to subscribe to this channel because I'm about to give you valuable health tips over here. Kel says, love your hair. Thank you very much. Thank you very much. Please don't forget to double tap on the screen to like this video as I'm about to take off. And please don't forget to subscribe to this channel because I'm about to give you valuable health tips. So let me start. So I'm going to be looking right here for a while or often because I have some points here. All right. So the next what I have here is today we are going to be talking about HIV. What exactly is HIV? What at all is HIV? Is it a death sentence? Which is a no. HIV is not a death sentence. So today we are going to dive more and much deeper into HIV. And tomorrow, we are going to be talking about the myths associated with HIV. All right, so let me get right into it. So today we are going to be talking about what HIV is, how it occurs, its causes, symptoms, stages, prevention, and treatment. So I'm going to be going over again. We are going to be talking about what HIV is, its causes, how it occurs, symptoms, stages, prevention, and treatment. Once again, please don't forget to double tap on the screen to like this video, and also please don't forget to subscribe to this channel because I'm about to give you valuable health tips. All right, so what at all is HIV? What is HIV? So HIV in full is known as human immunodeficiency virus. Human immunodeficiency virus. So HIV is a virus that attacks the immune system of the body, therefore weakening the immune system. That is HIV. And if it is left untreated, it's going to end up in AIDS. AIDS is acquired immunodeficiency virus. One may ask, why is it called human immunodeficiency virus? So the reason why it is called human immunodeficiency virus is because it attacks and weakens the immune system. Therefore, it specifically destroys the T cells because the T cells help fight off infections and diseases. But this is the case whereby because of the HIV virus, the T cells happen to be weakened. So this is why it is called human immunodeficiency virus. Please, I hope you are getting me. Please give me a yes in the comment section and let me know if you are getting me over here. All right. So the next thing is, why is it is called acquired immunodeficiency virus? So the reason why AIDS is called acquired immunodeficiency virus is because it's a condition that is acquired and not inherited. It's a condition that is acquired and not inherited, and is characterized by weakening of the immune system. Hence, it makes the body susceptible to opportunistic infections and diseases. So, what do we mean by opportunistic infections and diseases? Opportunistic infections and diseases are those infections that take advantage of a weakened immune system. Those are opportunistic infections. So now we've gotten to understand the meaning of HIV and why it is called human immunodeficiency virus. And we've also understood why AIDS is called acquired immunodeficiency syndrome. Now the next thing we are going to be talking about occurs. How does it occur? It is not an airborne disease actually. HIV is not an airborne disease. So let's dive into how it occurs. The first one is unprotected SEX. Unprotected SEX. So I don't want to be mentioning SEX in word because I don't get a strike. So unprotected SCX. So having SCX without using condom or other forms of protection can increase your risk of getting HIV. Unprotected SCX can increase your risk of getting HIV. Two, sharing of needles. Sharing of needles is also a very bad act because you may not know whether the needle might be infected with HIV virus. The next point I have here is mother to child transmission. For mother to child transmission, it can be passed on through breastfeeding or childbirth or even pregnancy. Now, let's talk about certain causes. What at all brings about HIV? What brings about HIV? Let's talk about this. So, HIV is a viral infection. That's one. It is a viral infection, as I said earlier. It is not an airborne disease or a contagious disease. No, it is a viral infection. It is caused by virus. And two, it weakens the immune system. This is one point I have here. HIV weakens the immune system. That's why I'm here to talk to you about what HIV is, why it's on the rise, what we can do to prevent it. And even if you have it, don't worry. There are certain treatments that can help manage it, if not cure it, manage it. Yes. So please, at this point, if you found value in this information that I've given you, don't forget to double tap on the screen to like this video and also subscribe to this channel because I'm still giving you the value you deserve to know about HIV. All right, let's talk about some symptoms that most times happen during HIV. So the first symptom I have here is flu-like symptoms. Flu-like symptoms. So early symptoms of HIV may include fever, headache, or fatigue. Early symptoms of HIV may include fever, headache, or fatigue. So these may be the one symptom of human immunodeficiency virus. The next point I have here is swollen lymph node. So first of all, I'm going to be explaining what lymph node is. So lymph nodes are small bean-shaped organs located throughout the body. So it's not only at one place, it is located throughout the body and plays a crucial role, meaning important. It plays a crucial role in immune system. And these are the functions. They help filter lymph fluid, help trap pathogens, and activate the immune cells to fight infections. So I've outlined the function of lymph nodes and what lymph nodes are. Now, let's see the symptom associated with it. Swollen lymph node. Swollen lymph node. So enlarged lymph node in the neck, armpit may be a symptom of HIV. Enlarged lymph node in the neck, armpit may be a symptom of HIV. Next point, skin rashes. So these skin rashes is not normal like the normal skin rashes that we normally see. These skin rashes may be experienced more than we normally see for the normal skin rashes. This one may become more and the person might experience it and also might experience lesions aside the skin rashes. The next point I have here is recurring illness. Recurring illness, meaning that it happens on and on and on. It doesn't happen and then it stops, on and on. So it as HIV progresses, the infected person may experience recurring illness such as pneumonia and tuberculosis. Such as pneumonia and tuberculosis. So please, at this point, if you are still finding value in whatever I'm saying, please don't forget to double tap on the screen to like this video and also subscribe to this channel because I'll be bringing you more and more valuable health content. Okay, the next point I have here is weight loss. So this weight loss is unintended. The person happens not to even intend on losing weight, and this normally happens at the advanced stage of HIV symptoms. The next point here is diarrhea. So diarrhea happens to be the last for happens to last for more than a week and may be a symptom of HIV. This diarrhea happens to last for more than a week and may be a symptom of HIV. Okay, fever. The next point is fever. And fever is also one of the points. Recurring fever can be a symptom of HIV. Now let's talk about the stages in HIV. Stages in HIV. So the first stage I have here is acute HIV infection. Acute HIV infection. So when you say something is acute, meaning that it's not so much, it's quite small, acute. That's how I understand acute. So acute, this is in the initial stage of HIV infection, and it normally occurs within 2 to 4 weeks after exposure to the virus. It normally occurs within 2 to 4 weeks after exposure to the virus. This is for acute HIV infection. The next stage is chronic HIV infection, and this stage occurs after the acute HIV infection, and this virus begins to replicate slowly. So that is the acute state. Sorry, that is the chronic state. So for the chronic state, the virus happens to replicate slowly. And for the last stage, which is the ACE, this is the most advanced stage of HIV infection, where the immune system is severely weakened. The immune system is severely weakened, and the body is more susceptible to opportunistic infections. Well, earlier I talked about opportunistic infection being infections that take advantage of weakened immune system. Okay, so now let's talk about how you are going to prevent human immunodeficiency virus. So the first prevention is use condoms. And condoms can significantly reduce the risk of HIV transmission. Two, get tested. Regular HIV testing can help detect the virus early and treat it early. And early treatment can even help than not checking and not getting to know your status. The next is use clean needles. Very important. Avoid sharing needles with people. Avoid sharing needles with people. It doesn't matter whether you know the person. Avoid sharing needles with people. The next is avoid sharing personal toothbrushes. Please take note of this point. Avoid sharing personal toothbrushes, razors, and nail clippers, which may be contaminated with HIV infected blood. You may not know whether the razor you are using might be affected with HIV blood or not. So it is very important to take good care of whatever you are using. So to be on yourself. Now let's treatment over here. So the first treatment is ART, antiretroviral treatment, and is a combination of medications that can help manage HIV and protect it from progressing to AIDS. That is antiretroviral therapy. Now, the next I have here is adherence to treatment. Adherence to treatment. This is very important. When your doctor shows you or gives you these particular medication or treatment, it is important to those essential to adhere to the treatment requirements and attend regular medical checkups. All right. So this is where I would like to put my live stream to an end. I hope you found this live stream very very educative. Please don't forget to double tap on the screen to like this video and subscribe to this channel for more health tips. And also, I have a video on HIV on my channel, so please you can go and check that video also for more